Hello, I'm Dr. Sanjeev Malhotra. I'm a principal consultant in cardiothoracic surgery at Max Hospital, Gurgaon. I've been working in the field of cardiothoracic surgery now for past over 15 years, and I have been operating both national as well as international patients from Iraq on the regular basis in Max Gurgaon Hospital. I studied my medicine from Bombay and my surgery at New Delhi. Now, in the cardiac surgery, the main things which you come across are, one is the bypass operations. The bypass operations are done for the blockages in the arteries of the heart. They usually come as a symptom of chest pain or being short of breath, and when the patient goes for the investigations like 2D echocardiogram and the coronary angiogram, we find the different sites of coronary blockages or the blockages in the arteries to the heart. What we do for these patients, beyond routine medical care and stenting, when the patient comes to us for bypass operation, most of the doctors put internal mammary artery. The internal mammary artery is an artery which runs inside the chest wall and is used to perform the bypass operation. This is used for performing one bypass operation. But the other bypasses, what people use is, most of the people use is veins from the legs. So you get a cut on the leg, they take out the vein from the leg and put that on the heart. The veins are used for the pressures like 10 to 15 millimeter of mercury. When we put them in the system of coronary arteries, they tend to degenerate or get blocked in coming years, maybe 5 years, maybe 7 years, maybe 10 years. But when we use internal mammary artery has been found to work for more than 20 years. So at Max Gurgaon, we use not one mammary artery, we use two mammary arteries. There's one on this side and one on this side. We harvest both of those mammary arteries and do bypass with those mammary arteries. Sometimes we also use an artery from the hand over here and use it for the bypass. These arteries have much better outcome and much better result when we compare with the veins. The vein burn out in 8 to 10 years, but the arteries have much superior and longer life, and the patient doesn't get symptoms in the long duration, the long run. The second case which patient comes to us are the valvular heart disease. The valvular heart disease is a broad term given for the patients who have either blockages or leakage in the valve of the heart. The valves are responsible for the flow of the blood from one chamber to the another, and it prevents the backflow into the chamber downstream. So when we come across the patients who have either the leakage or the blockage in the valves, they need surgery. The most commonly performed surgery for these blockages or leakage is the replacement. That is, the diseased valve is removed and artificial valve is put inside the heart. The artificial valve may be either made up of metal, in which the patient has to take the blood thinner for the rest of their life, and despite optimal blood thinners, may get a blood clot on the valve which may prevent the smooth functioning of the valve. The second valve which is available for replacing these valves is the tissue valve. The tissue valve works good for initial period, but it is known to degenerate in after 10 years or 15 years, mainly for the reason because it's made up of the animal tissue, which is foreign to our body. One of the techniques in fixing these valves is the repair. When the patient comes to us with a significant leakage in the valve or some leakage and some blockage, it is possible in selected group of patients to repair these valves. The valve which nature gave to us, which God gave to us, is the most precious valve and the best valve available for our heart. No man-made valve can match the outcome of our own native valve. So in the selected cases, we tend to repair these valves, especially the mitral valve and the tricuspid valve. We do not need to change this valve. The outcome of repair in these valves over 20 years is much superior to the replacement of this valve. The metal valves tends to get blocked again in coming years. The tissue valve gets degenerated over the years, but our own valve, when it's repaired properly, lasts more than 95% of the patients for over 20 years. Now, many cases who come to us for these surgeries also want to have surgeries with the minimal invasive technique. That means they don't want to have a cut on their chest in the front. Many cases are amenable for the minimal invasive surgeries. We can, if required, if the valve needs to be repaired or replaced, or in the selected cases of coronary artery bypass, can be done from using the minimal invasive techniques. That is, no cut in the front but from the side using the minimal invasive techniques.